Next, we're down to a very serious topic, which is the COVID-19 response at MDC. I know that has been an urgent situation that we all are very concerned about. So, Chief Richardson from MDC is here to update us on the COVID-19 response. Chief
Madam
Richardson?
Chair.
Yes.
Madam Chair, before Chief Richardson gives his presentation, I just really quick wanted to give you a kind of an overview of what's been going on at the MDC, very, very general and broad. And so he'll get into detail about COVID. But as you know, there's some serious issues regarding COVID at the MDC, regarding the cases. And just know that what's happening at the MDC, it's a reflection of what's happening in New Mexico. So the numbers in New Mexico went up. So the numbers, right, at the MDC, they're going to go up as well. And I can tell you, Chief Richardson and his amazing staff are doing everything they possibly can do. Early on, we reached out to the governor's office, and I'm going to say about 3 weeks ago, and they were wonderful. I reached out to them because we started to see the numbers going up. And then I think that after I called them in the morning, the chief and I called them in the morning. That afternoon, there was a meeting that was scheduled that included the Secretary of the Department of Corrections, the Secretary of the Department of Health, and there were, of course, the chief and his staff and staff from the governor's office. And so we all put our heads together to sort of figure out how do we move forward. And they have not skipped a beat. The Department of Health, they have been wonderful to try to help out at the MDC. As you know, what happens is if somebody gets COVID, there's a domino effect. Other people get affected, or they don't know if they're infected. So then they have to go into isolation, and then the staff can't report to work. And then what happens is you've got this domino effect. Then people have to work overtime, and the staff there is exhausted. They have done an amazing job. The corrections officers, the lieutenants, the sergeants, the captains, everybody, the medical provider, medical contractor, everyone is doing their very, very best. But I will tell you, they are exhausted. And I could not ask for a better chief at this time at the MDC. He has done a phenomenal job. I think we talk about 3-4 times a day, 7 days a week at least, right, Chief? He's always communicating, and he wants to do right by the MDC, by the county, by the inmates, by his staff. And so I just want you to know that the tremendous sacrifices that they've all made and the appreciation that we have for all of them. And just having said that, we will be coming to you and we will be talking about, the chief had asked me, we've been working on this for probably a month or 6 weeks, about hazard pay. And that's something that, we've got to show our staff our appreciation, not only at the MDC, but our public safety staff. They put themselves out there. They are in the front lines of danger of what's going on, and they're afraid, and I don't blame them. And so we have to do everything that we can to show our appreciation. And so we're working on something, and we will be communicating with you as to how we will be moving forward with the hazard pay. So with that, I'm going to go ahead and let Chief Richardson take over and let you know how they're handling COVID. Thank you so much, Madam Chair and Commissioners.
Thank you, Julie.
Thank you, Madam County Manager. Hi, yes, thank you for allowing us to be here this evening. I know there's a lot of concern of what's happening here at MDC. And speaking with the County Manager, I wanted us to come forward to the Commission to answer some questions and to give a presentation. This isn't only just about our inmate population, but this also has to do with our staff, our contractors, and everybody else here that works at MDC. There's a lot of things that we're doing, and I'd like, hopefully with this presentation, I hope it relieves some of those questions and answers some of those questions. So what I'd like to start off with is just the overview of what we're going to look at here. And I'll hit the high points. There's a lot of information in here. So we'll look at the MDC, the facility itself, our current status, some of our proactive prevention efforts, our infection identification, our containment efforts, our communication and collaboration, as well as some of the challenges that we are facing. So again, just looking at MDC, we're sitting on 155 acres, about 12 acres of that is under the roof. We have 555 current employees, 438 security personnel, and of course, we're a little bit low on that through recruiting and other areas. 117 others in operations, plus approximately 200 folks in contractors. Our maximum capacity at MDC under McClendon is 1,950. Our average daily population in September was about 1,141. As of October 26, we're looking at about 1,297, and that will fluctuate depending on arrests and releases. Again, we have 5 housing units and 36 pods. We have a receiving and discharge and transfer unit. We have the medical infirmary. And then also we work with direct supervision. I'd like to draw your attention to that right there, because there is a big difference in direct supervision, what you see here at MDC and what you may see at other correctional facilities. What direct supervision means that our officers are working in the pods with the inmates. They're in direct contact with them. They're with them for 8 hours. There are some security advantages to that, maybe as far as being able to detect certain things and get to certain things a little bit quicker. Whereas in other areas, they may be working in a tower behind something else. But that also creates an issue as far as long-term exposure to our employees being there, even though they're provided with the PPE. And then again, when you include the overtime and the forced overtime that goes along with it, it puts our officers at a little, I wouldn't say a little, it puts them at risk. It puts them more at risk for a number of things. And in this case, since we're talking about COVID, it does put them more at risk for COVID. So currently our status at MDC, we have 53 active, if you can back up real quick again. Right now we have 53 active staff. That's 51 of our county employees being our officers, 2 contractors. Year to date, we have 91. All of our positive staff members are required to quarantine for a minimum of 10 days from the onset of their symptoms or resolution of the fever, 10 days after a positive test for asymptomatic. So there's a lot that goes into this. What I want to express to you all is that everything that I'm presenting here today and how we figured out the housing and how we are working with how long someone quarantines, how long they're isolated, this has been in conjunction with our medical professionals, meaning we're working with Centurion, who we have here. We are working with DOH on a daily basis to discuss this. And we have also, which I'll touch on later, we've met with other facilities similar to ours to look at and crosswalk how we're doing things. So right now, we're about, I can't see because my picture's in the way, I think we're about 14%. So, and then before we are releasing people to come back to work or releasing folks from the pods, there's a clearance required from the doctor of health order. That may be changing too. We just have an email today that the Department of Health has been inundated with a lot of testing and a lot of requests. So we are working still with DOH to make sure that we bring our officers back to work, make sure that we are working with the inmates and other staffs to make sure that once we medically clear them, we are doing it appropriately and according to DOH and CDC guidelines. Currently right now in the facility, we have 185 active cases, and that is working with the 10-day count. Previous to that, we were working with 14 days. DOH has changed those recommendations. Up to right now, we had to year to date, we had 526 cases. And again, inmates are required to quarantine for a minimum of 10 days from intake till they hit the facility or from the onset of symptoms or from the time they test positive if asymptomatic. I don't know the percentages for asymptomatic inmates or officers, but I would venture to say, and Director Otero can help me out on this, that the majority of them have been asymptomatic. So, and again, before we clear anybody, the contractor or medical professional is involved in before we clear anybody medically. So again, going to what the county manager was talking about earlier about our cases and how they mirror the community. This is back starting all the way in March when we had our first case. And as you can see through time, we stayed very, very low MDC staff. And it just kind of followed along the line with what we're having in the community up until October. And in fact, in a lot of areas here at MDC, we were able, thankfully, to mitigate COVID up until October when we had a huge spike in our numbers. And then again, when we're looking at MDC staff versus community cases, again, it follows along the same trend as what you see there. We have in the beginning, all the way back, as far as April or May. You know, we were very, very low with staff cases, and we were actually way below the community spread or communal spread within the community. And then as you looked again in October, we had a quite a spike, which follows along with what happens outside these walls. And then the last graph that we have is MDC inmate cases versus community cases. And again, if you look at it, we were actually in pretty good shape here at MDC at the very beginning of May. If you look at the community outside the walls, it was very high or higher. And then we were able to, all the way through August, September, we saw a little bit. And then of course, in October, we had quite a spike. So again, a lot of times, whether it's this or other areas, what you see out in the community, what you see outside of MDC, you will see inside the facility itself. So we've done some prevention efforts, and I'll go through those. There have been a lot of them. So right now we have 59 employees working remotely from home. 22 of those are full-time at home. 37 of those are part-time. Here at the facility, when you come in, you have a single point of entry for staff. That's everybody that comes through there. And right before you even get in the door, there's a hand washing station. And then before you get in the door, there's something to sanitize the bottom of your shoes. Then once you get through the foyer, then you have a hand washing station. So those are all just prior to coming in, before you even get in the door. And then once you get in the door, there's a medical screening portion. So that's where we do the screening. They ask the questions. This is with Centurion. They do a temperature check. They check oxygen saturations, and they take your temperature as well. One thing that Centurion noticed here when we had some people that are asymptomatic, some of the other symptoms that you normally don't see or that you don't normally hear about, they were checking oxygen levels of people. And when they've checked the oxygen level, and for them, when it's at a certain percentage, that obviously sends out a red flag to the medical professionals or to Centurion. And at that point, those individuals are checked for COVID. So that is something, I don't know if a lot of places are doing that, but that's something we're doing here. Employees that are not, that do not pass the screen are not allowed to work, and they're required to test. One thing we have worked on the testing here is with DOH and with Centurion is prior to, they would have to go someplace else to test. Right now, we're trying to be more self-sufficient. So whenever we have an employee, for instance, and obviously the inmates, but when you have an employee, they're not feeling well, no matter what it is, they feel like they're having symptoms. They may even be at home and start feeling symptoms. They are contacting our shift commander. Our shift commander is contacting our medical contractor. We're setting up a time, and we're able to bring those individuals to MDC and test them here. Also, what we've done on the testing, we've talked with DOH before, it took some time to get some of the results back. And one of our past meetings, we're able to set it up to where we cut out the middleman, and we were able to call directly to DOH now and start getting those results rather than waiting for faxes to come in, which has allowed us to notify our officers and notify and advise inmates within 24 hours or maybe a little bit more rather than 2 or 3 days, which is customarily what we had seen before. Our staff and the inmates here are issued PPE for the staff. They are required now to, they always have been required to wear the mask in the back, but after some of our meetings, we're also out requiring them to wear their safety glasses as well while in the facility. Our employees are issued the cloth masks, which came out early on. They're issued surgical masks. They're issued N95s. They're issued safety glasses and or goggles, depending on where they're at. And they're to have their gloves readily available. They have always carried gloves. We're just making sure that they have them ready available now. There may be additional PPE that's required for them to work in restricted housing areas, such as the gown, the N95, the KN85, the face mask, and so forth. There are signs posted outside every pod letting the officers know what is required to be worn in that pod. And how did we come up with those recommendations and that PPE? Again, we're working with the Department of Health, following CDC guidelines, and working with Centurion, our medical provider, as to what is the best PPE for those certain situations. Also, there is a restricted housing memo that is put on the team site, so they can refer to that, so they can see what's going on within each pod. And as anything changes, there's a facility-wide email that goes out to that. So we're trying to provide a lot of information for the employees and the inmates as well. So what training have we done? We've been working with risk management for the proper donning and doffing of the N95 masks. There's some things that go along with that as far as physical training, being able to check your seal, having the right mask. We have contact tracing protocols. We have a PowerPoint for the contact tracing protocols. We have a group of individuals here that are been trained. They know what we're looking for. Again, they're following the recommendations of DOH and the CDC. They're quick, they're efficient, they know what we're looking for, and they can get on to the cameras and start looking at different things for us as far as the tracing protocols. The Department of Health came through and they offered proper hand washing protocols, because we do emphasize that. We also have resource materials that are available to our people, and we're looking for more on staff resiliency, because there are some folks it is difficult to deal with. COVID safe practices, recognizing COVID symptoms, exposure to and response controls, and mask protocols. So we are putting out that training, and we're looking for more all the time to brief our people and pass it on to the inmates. Again, medical intake COVID screening procedures. Again, we're looking at the personal protective equipment for everybody. All the inmates here are provided with 2 cloth masks, and those are turned in when they're laundered, and they're issued 2 more. We're trying to keep up on that. We encourage the inmates to wash their hands in a regular cell and pod sanitation. We emphasize social distancing of 6 feet or more to the extent possible. Sometimes it will get closer together when we have to separate them. As far as timeout, depending on what area they're in, and if they're restricted housing, there's out of cell time is conducted either on an individual basis when they're coming out one at a time, or in very small groups. Again, this is done with the cooperation of our Centurion DOH classification to come up with these methods and these protocols. Again, we have restricted movement of inmates to prevent the community spread within MDC. And the inmates are also inmates provided with surgical mask. Oh, so we'll go back to when we're talking about releasing. So inmates are provided with a surgical mask upon releasing from MDC to keep from community spread. And we'll touch on that more here in a bit. So again, working with our medical contractor, they have established COVID and influenza SOPs. They provide us with continual updates and information based on the best practices, right? This includes screening tools for staff and inmates, clinical guidelines, assessment, and other information. So some of the things we've done within the facility to help out, we've regular sanitation protocols for all the areas for receiving and discharge, medical housing, vehicles, bathrooms, our fitness center when it's open. We will follow on the fitness center here. It's a good thing for our officers because they are here a lot of time, and helps them to stay in shape, relieve some of the stress. But we do follow the guidelines from the county on whether we have our fitness center open or not. Recently, well, a while back, we purchased 2 Halo disinfection systems. Those are used for large areas. Those are placed in there. It's basically a fogger where it disperses COVID killing disinfectant to those areas. And recently we purchased 5 electrostatic sprayers for each one of our units. So the captains in those areas can also continue and do a better job we can do a better job of providing something for them to clean their areas. Some of the other things that we're doing to prevention efforts, we're still having attorney visits remotely using the tablets inside the pods. Phone has always remained accessible to inmates for legal and social calls. And when those tablets are being used, just so you know, and the phones, there's a BO, which is a bay orderly, or the officers in there. They're trying to keep up, make sure that we wipe down the tablets and wipe down the phones. Courts are being conducted by video inside the facility. Based on what's going on, we can either move with them, but right now, because of the way it is, the inmates are staying within their pods, and they're going to a tablet or to an area there within the pod in order to meet their court obligations. And then visitors to the facility are limited to those assisting us with COVID. Also, we will see law enforcement, which we are still working with in here, if they have a search warrant for certain things in order for them to continue with their jobs. Some of the other efforts, and you'll see as long with other agencies, like I mentioned before, we have daily communication with the New Mexico Department of Health. Not only is it daily communication throughout the day, every morning at 0800, we will have a staff meeting that includes all the players here at MDC and DOH. And we will meet at 8 o'clock in the morning to discuss COVID and what's going on and COVID protocols for that day. And that usually around 9 o'clock on Saturdays and Sundays, we'll also hold that meeting. So there isn't a day that we don't go without a meeting. We've been working with risk management to ensure MDC that we're following the OSHA requirements, because those are also important. We've talked with law enforcement to use some discretion for lower level offenses, because we understand, and I understand for sure, that sometimes a physical arrest is not needed or physical incarceration is needed. There's other ways of dealing with illegal activities or something unlawful out in the street. By no stretch of the imagination during those conversations, like was brought up before, if it has to do with domestic violence, DWIs, violent crimes, that was not even in the discussion. We're looking at some of the very low level stuff that can be handled in different ways. Currently, we've scheduled a tour for the DOH to come down to our prisoner transport unit to evaluate and provide us recommendations on our protocols. And we have protocols with PTU and with APD down there, and we just want to make sure that we have that reviewed and we're doing the right things. And some of those deals, again, like I talked about, we worked with law enforcement regarding the proactive transport of arrestees. So to give you an example, if an officer arrests somebody and they're on the way to PTU downtown, and the person they arrested makes mention that they may be a source and contact, or they've been tested, immediately they're directed up to MDC. They're not even going to PTU, because we don't want to have them go in that area. They're being directly brought to MDC, notifying us. MDC goes into the protocols where we're evacuating those areas. Our officers are putting on their PPE, and that individual is being brought in. We do have sometimes when it doesn't exactly happen like we want it to, but for the most part, those officers bringing in that arrestee are giving priority to get them triaged and processed and put into the appropriate area where they need to be. Some of the other efforts that we're working with, we bi-weekly, and probably as we're moving it to weekly now, we produce a list, and that is sent to the county attorney. And those lists include the charges, and those lists also include those inmates that might have some sort of medical condition that make them more vulnerable. We provide those to the public from the county. Those are provided to the public defender's office, as well as the DA, and then forwarded to the judges for their review to see what they want to do with those individuals. We're also working with the district attorney's office and public defender's office to identify inmates with low-level nonviolent issues here that may be some other release or adjudication as possible. We're still continuing to use the community custody program for those inmates that meet the criteria. And we are also working with probation and parole to identify alternate means for those individuals that are probation violators, not parole violators. Some of the things as far as infection identification that we're working on, again, we visit with our medical provider, our on-site representatives, and then we also have people here from DOH that we work with. Again, to reemphasize, we have daily medical screenings of staff and contractors prior to the entry. We have weekly COVID testing. We have inmate testing is ongoing, and we're continuing with our ongoing sick call treatment for the inmates. Staff testing is on all 3 shifts. Usually we probably test approximately about 80 staff members per week that submit to the testing, volunteer for it and help us out on that. That doesn't include the testing that's provided by other providers off-site. Inmate testing right now, we're testing about 200 inmates per day, which is about 1,000 per week. The results are always communicated from the Department of Health or the medical provider. Inmates results are provided by the Department of Health to our provider here is responsible for notifying the inmate. Here at MDC, some of the data that we keep is we keep track of the data testing, the data symptoms, if any, the results, what those results are. If it has to do with one of our employees, we look at the last day of their work, and we also look at their expected date to return to work. Inmates are tracked by the medical contractor and the Department of Health. Some of the things we're looking at with containment protocols, we conduct contact tracing. New Mexico DOH does their own as well, but we also conduct our own. Our contact tracing is conducted as soon as staff or an inmate positive test is received. A lot of times it's also the majority of times, if we have an employee that says that they're symptomatic, before we even know, we'll start the contact tracing. With the early contact tracing, the way we do it, it hopefully helps us out, minimize the community spread of staff and inmates who may have had close contact with those individuals. How does our contact tracing work? Again, we have a group of individuals have been trained, so there will be interviews with the individual that is reporting symptoms or maybe positive. We start looking at staffing rosters. We review inmate housing records to see if that officer was working in there, maybe if it's inmates who they're housed with. We start reviewing out of cell records. And then, of course, we start looking at reviewing facility video for a number of days back to track that officer or that inmate throughout the facility. On this, if you would, Mrs. Director Otero's on this one. She has been very, very much involved with how we're doing the classification and the housing protocols. The classification and housing protocols are done with the assistance and recommendations of DOH, along with our classification and our resident medical contractor. So I'll turn these two over to Director Otero.
Yes, go ahead, Director Otero. You might be on mute.
Good evening, Madam Vice Chair and members of the Commission. As inmates are intaked into the facility, as the Chief stated, they are screened by medical prior to coming in, and then there's a COVID screening done. We have identified pods within the facility in which we quarantine inmates upon acceptance. In these quarantine units, inmates will have a COVID test between 5 to 7 days. And as the Chief stated, this was done in collaboration with Department of Health and coming up with these guidelines and these test dates. So if an inmate tests negative within that quarantine time, they can be moved into general population on the 11th day after we receive a negative test result. If the inmate refuses to be tested, then they will be quarantined for 14 days. And on the 15th day, they will be moved to general population. And this will be the same for inmates that we may not have a test for. We make sure that they're quarantined for that total time. Upon intake, inmates are housed together based on their classification and admittance date. So if inmates are admitted within a certain date, we want to make sure to keep them together because that's when the quarantine time period starts. So that's important for us to keep those dates as they come in, and those inmates will be tested upon those dates. If an inmate comes in, they state that they have been in close contact with a person or that they have been in contact with a person that has tested positive. We have identified other areas within the facility that these inmates can be held. So we want to hold them in a different housing area so we don't potentially expose other inmates upon intake. If inmates are symptomatic, they are assessed by medical, and we determine with them what the appropriate housing would be. I think the Chief kind of touched on this as well, that inmates, we really haven't seen a lot of them that have been, most of them have been asymptomatic. We haven't seen a lot of cases where they've been really ill with their symptoms. It's been like, headaches, cold, chills, those types of things. But if an inmate comes in and they are showing symptoms, they are immediately assessed by medical. They are taken down to medical. They're seen by a provider, and a test will be administered usually immediately, but if not, no later than 24 hours so we can see the results and know where to house the inmate if they are positive and what's going on. Inmate housed in general population that test positive will be separated from inmates that test negative. So if there was a possible exposure within the general population, we want to make sure that we separate those inmates out. So if we have units that an inmate may test positive and we have inmates that test negative through Department of Health guidelines, we will remove the inmates that are positive and shelter them together, and then the inmates that may have been possibly exposed within another area. So if we can group the inmates together that have tested positive, we can quarantine them for 10 days. And within that 10 days, on the 11th day, as long as they're not symptomatic within that time or not have any illness or sick calls or anything like that, we can release them and they can be a general population pod again. Inmates that potentially could have been exposed, we want to continue to test them. And I think that's why we've had so many tests administered within the last few weeks, because we want to make sure that no one has been exposed. So what we do is we'll test inmates on the first testing that comes up. If they're negative, we have to have 2 weeks of clear negative tests before that pod can be released from restriction. Moving to inmates, anytime that we are discussing movement of, as I talked earlier about moving inmates that are positive and inmates that are negative, it's a total collaboration between classification, medical, security, and we have protocols in which we follow to make sure that there's no cross contamination, that we are doing the appropriate things within the facilities to make sure that we are not exposing other inmates or staff.
Okay, thank you, Director Otero. So some of the other things we're looking at too is the communication and collaboration we talked about before. And again, to mention, we meet at every morning, Monday through Sundays. And we also have DOH representative that participates in that. So we're not losing anything in translation. Again, our medical contractor is in constant communication with the Department of Health, and that's usually Dr. Durham. Josh, I can't say his last name, and a gentleman named David, they have been accessible to us, our medical people, for us to communicate with them all the time. We've included our public information officer in as well, Ms. Julia Rivera. She does a lot of work as far as getting information out. When I'm unable to, she'll communicate for me to the county manager to let her know what's going on. She will notify the stakeholders of all the relevant information. She has conducted interviews with the media. She provides news releases concerning the cases. She reports the daily numbers for us, and she provides information to staff when asked to do so. Some of the other efforts that we met with, we've talked with within the county and state on protocols. So the county manager mentioned a meeting a while back where we had a lot of stakeholders from around the state, Department of Corrections, DOH, a number of other folks, and we went through what we do and how we handle things here, and asked them for some recommendations. They gave us some recommendations, so I was happy to report that we had done a lot of things really well, and there were maybe some other changes that we need to make. We also met with Pima County Detention Center. Pima County obviously is in Arizona. It's a detention center that's similar in size to ours, and our medical contractor is the same at both facilities. So we wanted to make sure that we were doing a crosswalk to mirror that that our protocols were the same and that we were working with the best practices. Recently, we had the Department of Health come down to MDC. This was on the 16th. We gave them a tour of the entire facility. There was a number of folks that came down from DOH, including, like I said, Dr. Miranda Durham, David, and Josh. And they came down, they inspected the facility, and they provided us with some recommendations. And again, we received positive feedback from what we were doing. And then just most recently on the 23rd, we had a meeting with plaintiffs interveners having to do with McClendon, and they invited Dr. Greifinger, who's the federal oversight for medical from the federal courts. And he sat in on the meeting with us. And again, we went through everything that we're doing, all the protocols, what we are doing now, what we are looking at doing. And again, he was with us on that meeting for 2 hours. And again, we got some positive feedback from him that we are, addressing this correctly. We are open to questions. We are open to recommendations. I know there's been some articles and stuff that were not transparent about what's going on here at MDC, and we're constantly looking out to see what other information we can gather. It's every day of the week. And we will continue to do that. Again, we're scheduled the tour for the 29th. That'll happen Thursday of this week to go down to PTU. And then along with risk management, we've also been working with Richard Clark from Emergency Management Center, and also been in very close contact with Chief Greg Perez with the fire department, also on EOC stuff, going through and just sharing information, getting information, and talking with each other about the efforts that we're making here at MDC and into some cases countywide. We are facing some challenges here, which I'm sure you can understand, but the less manpower we have is creating an additional workload for our remaining staff. And with that, I do want to let the commission know we have had from the staff on down, from the captains all the way down to our officers, but our officers, our sergeants and our lieutenants and our officers, the ones that are in the back, we have had a very good core group of officers and supervisors that have been here. They're working the long hours. They're working the overtime. They are tired. We are trying to bring officers back to work as fast as possible, safely, I might add. But I want to congratulate those officers and those supervisors publicly, because they're doing a great job. And I think they're sometime overlooked. I will say this, that, you know, I look at these officers, obviously they are essential personnel, and I also look at them as first responders. I've said this before, that you may not see them in the same capacity as you see law enforcement or firefighters, because they're not out in the public eye at all, but they respond to the same sort of incidents within the facility, and they do a great job. And again, I'd like to thank those officers and those supervisors who are here day in and day out, working to make this place better. So, and operate. They're carrying a heavy burden. So we're still continuing with our recruiting efforts. We've hired 79 correctional officers here recently. We're using social media a lot, because it's hard to have groupings and the other gatherings that we used to have or be part of that. And so it kind of explains everything we're doing there. It's either by telephone or by web. Some of the candidates that do slow us down a little bit, if they are accepted then from out of state, then they're required to come here and quarantine for at least 14 days. And they're released on the 15th day before they can even start the cadet class. So they'll start a little bit later. We're looking at revising. We have revised our curriculum and our corrections academy to conduct 8 academies a year. We have had, and I'll talk about this here in a little bit, we have had some issues regarding staff sick leave usage and other types of usage. We're looking into that to see how we can resolve those issues. We're working with HR, and we're working very diligently to try and correct that. One of the things that we're looking at too, and is looking at probationary period for our correctional officers. When our correctional officers are coming in before they're getting off probation, they're not accumulating, for instance, vacation. And when they're here working normal operations, it's a long year. And with something like this, it's even longer. So I think that may be, in fact, I know it's contributing to some of the use of leave. That I think maybe at some point in time, if not very soon, we need to look at how we address our probationary officers. Again, as the county manager mentioned before, in conjunction with the union, I have asked for us to discuss and look at the need for hazard pay. Again, when I'm looking at what the officers are doing here, the amount of time they spend here, I think it's something worthwhile and that needs to be looked at. Again, working with the union, we're looking how to reallocate our staffing and our resources to ensure the safe operations of the facility. They've helped us there, and they've worked well with us there. And then we also, not only do we have the officers that are here on the line that work in the facility, we have specialized assignments within the MDC, and those officers have been reassigned to help us with duties inside the facility itself. So there's some worry, and we'll talk about this. So we do provide our officers with some information regarding the available resources for counseling and assistance with COVID, including AAP. It has come to, in some cases, to that level. Informations are provided, information on COVID. One of the key things that has come up, we touched on this earlier, is how we release inmates. So what we need to understand is that inmates, once they're released, they're released. They're no longer in our custody. We have no way of holding them or making them stay here. If that individual is someone that is positive, we have to release them. So when those individuals release, along with the normal releasing process, those individuals are also given additional information on COVID. They're provided with PPE such as a surgical mask, And then we contact DOH to let them know that this individual is being released and they will be out in the community. And one of the missing pieces that we're working on right now is Director Otero has been working with Albuquerque Outreach for those individuals that are released to maybe provide them with some sort of housing so they can continue with the isolation period and they're not out into the facility. So those are some of the things that we're working on there. With the officers, and it's very, very important with the officers here. They have the same concerns because they are here long hours, and I understand. And I want to mention here, the officers come in here and work again. Like I said, they work long hours, and when they leave here, they're worried for their own health and their own safety. And they are provided with PPE. But when they're going home as well, they're also concerned for their family members. They also have family members that are at home which are elderly or might have some medical conditions which make them more vulnerable. So they're concerned for that as well. So they take that with them. So I don't want to leave that out. I mean, they come here and they work, and we see them here as working. But when they're not here, they're just like all the rest of us. They have families and friends and grandparents and uncles and aunts that they're equally as concerned about. And so I think that needs to be recognized as well. And with that, I appreciate your time. I wanted to provide this information to you. I know it was a lot of information. So with that, Director Otero and I stand for questions.
Thank you so much. That was a very, very comprehensive report, and I think it was necessary to let everybody know what is going on there and all the work you're doing to try to keep people safe and all the pressure and stress around that. It's a tough situation all around.